Can I use sunbeds after surgery, and how can I protect my scars? Okay, so the thing about whenever someone comes to the clinic and talks about sunbeds, um, sunbeds aren't good for you. So it's a bit like when people are smoking. Excuse me. There's specific things about um, smoking, and it's not good in general. But we have specific advice in terms of surgery with stopping smoking, and it's the same with sunbeds. The general advice is sunbeds are not good for you. Um, that's the general advice. But then specifically, and everyone says, "Yeah, I know, but whatever, I'm okay. I want to do them." So then you want specific advice about surgery. So the overriding thing is sunbeds are bad for you. They are basically the same as sun bathing, which is burning the skin, which is basically what tanning does. It's tanning, it's burning the skin, but so that isn't good for your skin, and it isn't good for the elasticity of the skin, and it means you're more likely to have wrinkles, and you're more likely to sag. Your skin's more likely to sag in the future. So sunbeds are not good, exhibit A, but they are particularly bad in terms of surgery, which is what this question is talking about. Because if you get, sunbeds are the same as suntan. If you get suntan on a scar while it is red and active, you will end up with a pigmented scar. You'll end up with a brown scar. So what happens if you have a scar, when you have surgery, you have a scar, and the scar's always a little bit red to start off with. And I normally say it takes 3 to 6 months. It starts to fade about 3 months, 2 or 3 months, it starts to fade. It can take 6, 12, 18 months to fade. It can take a long time for it to fade. So I normally say the first 3 to 6 months is red, but it can be longer. While the scar is red, that means the scar is active. And while the scar is active, if you get a tan, you'll get a tan on your body, and that'll be fine. But then when you come home and you lose the tan, the scar will stay tanned. You'll end up with a pigmented scar. So you mustn't get a tan on a red scar. So can I use sunbeds after surgery? Well, if you must, you can. But if you've got a scar, which you presumably have because you've had surgery, you mustn't get a tan on the scar. So here we go. How can I protect my scars? So sunbed, you're probably best to protect it by wearing clothes, or sometimes people wear a plaster over it, over the scar. It does mean you get a funny shape tan. If you're going abroad, or if you live in somewhere that's hot, or if you're in it's summertime in the UK, say, and you've got a scar on your face, things like a wide brim hat, high protection sun block. What you're trying to think of is you're trying not to get a tan on that bit of skin. So just try and think of ways that you can avoid getting a tan on that bit of skin, and that should protect your scar. So that leads me to the next question. Khan is here. Nice to see you, Khan, and thank you for your questions. So that needs to be my next one, which is a similar sort of thing. Is swimwear enough protection whilst on holiday? I think this is sort of linked to that first one. So yes, swimwear. So obviously when you're wearing swimwear, when you're wearing clothes, you don't get a tan on that bit of skin. So you have white, that's your white bits. So if you have a breast scar from a breast augmentation, that's usually hidden in a swim, in a bikini. Tummy tuck, you probably have to get the right bikini to hide a tummy tuck scar. Obviously a swimsuit would hide it, but yeah, if you've got a swimsuit on, your skin underneath your swimsuit isn't going to get tanned, so that is fine. You don't have to think you don't have to protect it more than that. That is fine. It's really you just trying to avoid getting a tan on the scar. And so swimwear is fine, but if it's on your face or an exposed area, high protection sunblock, wide brim hats, repeatedly putting the sunblock on. So that means high protection means SPF 50 plus, and then reapplying it if you're going in the water and things like that. Those are sort of advice in terms of sun protection.